Good morning, everyone. My name is Matthew Gallotti, and I'm the head of the Justice Department's Criminal Division. Thank you all for joining us today as we announce the largest coordinated healthcare fraud takedown in the history of the Department of Justice. Today marks a decisive moment in our fight to protect American taxpayers from fraudsters and to defend the integrity of America's healthcare system. We are announcing today charges against 324 defendants for their alleged participation in healthcare fraud schemes involving approximately $14.6 billion in false claims submitted to Medicare, Medicaid, and other healthcare programs. In a takedown this large, I can't possibly describe all of the work that went into dismantling each scheme, but there are 4 key points that bear emphasizing. First, let me be clear about what these healthcare fraud schemes mean for every hardworking American family. These criminals didn't just steal someone else's money. They stole from you. Every fraudulent claim, every fake billing, every kickback scheme represents money taken directly from the pockets of American taxpayers who fund these essential programs through their hard work and sacrifice. And when criminals defraud these programs, they're not just committing theft. They're driving up our national deficit and threatening the long-term viability of healthcare for seniors, disabled Americans, and our most vulnerable citizens. This enforcement action involves the seizure of cash, as well as luxury vehicles and properties, returning real money to American taxpayers and to our government healthcare programs. Second, we are seeing a disturbing trend of transnational criminal organizations engaging in increasingly sophisticated and complex criminal schemes that defraud the American healthcare system. As part of this takedown, we've identified and charged defendants operating from Russia, Eastern Europe, Pakistan, and other foreign countries. These individuals have infiltrated our healthcare system to steal American taxpayer dollars. As just one example, we dismantled a scheme involving a sophisticated operation run from Russia and Eastern Europe that strategically bought dozens of medical supply companies in the United States and submitted more than $10 billion in fraudulent healthcare claims to Medicare. To make matters worse, these perpetrators used the stolen identities of more than 1 million Americans spanning all 50 states to perpetrate this scheme and submit these false claims. But I'm pleased to report that federal agents intercepted and arrested key members of that organization at U.S. airports and the U.S.-Mexico border, cutting off their intended escape routes. The days of transnational criminal organizations using the American healthcare programs as their personal piggy bank are over. Third, this takedown resulted in criminal charges against 74 defendants, including medical professionals who fueled America's deadly opioid crisis for personal profit. These are not isolated instances of poor judgment. These are calculated schemes designed to exploit Americans struggling with addiction while enriching the very people who were duty-bound to help them heal. We charged pill mill operators who prescribed unnecessary opioids. We dismantled networks of corrupt pharmacies that existed solely to distribute drugs to addicts and dealers, feeding the addiction crisis that has devastated so many American communities. This is not healthcare. It is a staggering breach of trust. And under my leadership, the criminal division will prosecute these criminals as aggressively as we would any drug dealer, because that's exactly what they are. Fourth, many of the defendants charged as part of this takedown specifically targeted our most vulnerable citizens, elderly Americans in nursing homes, individuals with disabilities, those battling serious illnesses, and more. For example, our prosecutors charged 7 defendants, including 5 medical professionals, in connection with approximately $1 billion in fraudulent claims to Medicare and other healthcare benefit programs for performing medically unnecessary skin grafts on dying patients as they were seeking to spend their final days with dignity and peace. That conduct is exactly as callous and disturbing as it sounds. Patients and their families trusted these providers with their lives. Instead of receiving care, they became victims of elaborate criminal schemes. Today's takedown marks a historic day. In addition to the tireless work of our Fraud Section's Healthcare Fraud Unit, this extraordinary effort would not have been possible without the law enforcement agencies with me here today. Health and Human Services, Centers for Medicare and Medicaid Services, the Federal Bureau of Investigation, and the Drug Enforcement Administration. And of course, countless partners across the federal, state, and local law enforcement community and dozens of United States attorneys' offices. Thank you to all who made today possible. Now, despite these historic achievements, we aren't resting on our laurels. We're making advancements to stay ahead of their criminals and their illicit schemes. That is why today I'm also announcing that we are working with our partners at FBI, HHS OIG, and other federal agencies to create a healthcare data fusion center to revolutionize how we detect, investigate, and prosecute healthcare fraud. These efforts will be led by the Criminal Division, specifically the Fraud Section's Healthcare Fraud Unit, and comprised of data specialists from the unit's data analytics team. The Fusion Center will break down information silos using coordinated data analysis to enable our investigative teams to quickly identify and dismantle emerging fraud schemes, preventing money from going out the door. Today's enforcement action represents the largest healthcare fraud takedown in American history. But it's not the end. It's the beginning of a new era of aggressive prosecution and data-driven prevention. Thank you. I'll now turn it over to Acting Inspector General Juliet T Hodkins, Department of Health and Human Services, Office of the Inspector General.
Good morning, and thank you to Mr. Gallotti and to the Department of Justice for inviting me to join here today. Combating fraud, waste, and abuse in Medicare, Medicaid, and other HHS programs is our mission at the Office of Inspector General. I am proud to be here today representing the tremendous work of our criminal investigations team in this takedown. This unprecedented healthcare fraud takedown is more than twice as large as any past one, having stopped national and global fraud schemes alleged to have resulted in over $14 billion in intended losses. The results announced today were only possible, though, through a strong partnership of federal and state agencies. By working shoulder to shoulder, we harness the best information, tools, and expertise to find criminals, no matter where they hide, and no matter how they try to disguise their crimes. I would especially like to thank DOJ, CMS, FBI, DEA, and our other federal partners that are here today. I would also like to acknowledge the state Medicaid fraud control units, as well as the strong public-private partnership between government and private insurers to combat health fraud. Simply put, criminals go where the money is. Through information sharing, government and the private sector help each other to more efficiently stop fraud. And under our watch, criminals will not be allowed to enrich themselves with dollars meant to improve the health of Americans. One massive fraud scheme that was charged as a part of today's takedown involved multiple durable medical equipment companies that billed Medicare over $10 billion for equipment that patients did not need or that they never received. The good news for the American people is that the alleged criminals in this scheme never got their hands on most of that Medicare and Medicaid money that they tried to steal. Instead, the government coordinated to use our collective tools and authorities to protect taxpayer dollars. This takedown also demonstrates, though, our commitment to shield Americans from harm. The actions taken by our partnership stopped individuals and entities that were alleged to have used stolen medical identities from over 1 million patients to submit false claims. They preyed on patients who needed addiction services, billing for treatment that was never received. They illegally diverted prescription opioids, millions of pills that continue to fuel the devastating opioid epidemic. But as fraud schemes span borders and jurisdictions, OIG and our partners respond quickly and effectively. And as fraud schemes increasingly exploit technology, we use cutting-edge investigative methods to detect fraud, prevent losses, and protect patients. Before I close today, I must take a moment to applaud the exceptional work of the dedicated OIG professionals that participated in this takedown. Every day, these outstanding law enforcement professionals do the dangerous work of holding criminals accountable. Thank you for your service to the American people. Thank you so much, and I will turn the microphone over now to Dr. Mehmet Oz, the CMS Administrator.
Let me put on my clinician's hat first, because it is my culture, my story. I'm a heart surgeon. And when I hear about this fraud, I think about patients who have trusted us, people who are at their most vulnerable time looking for the protection of our services. And too often, these criminal entities have tried to pierce that trust. When you walk into the Health and Human Services building not far from here, there's a quote from Hubert Humphrey, from whom the building is named, and it says, "It is the moral obligation of government," that's what we're doing here today, it's the moral obligation of government to protect those who are at the dawn of their life, our children, those at the twilight of their life, our seniors, and those living in the shadows, folks who are having trouble, like the substance use disorder mentioned a second ago by Juliet. I want to applaud all of the agencies that collaborated today, because when President Trump signed the executive order on fraud, waste, and abuse, a pledge to crush this reality, this is exactly what he had in mind. At Health and Human Services, under leadership of Secretary Kennedy, we have strived to break down barriers and silos in every way possible. What you're witnessing on stage today is exactly that. The American government at its best, making sure all of us work together for the same common purpose, in this case, especially, expressly to protect those who are our most vulnerable. Because all great societies are judged by how they take care of those who are vulnerable, and we are great people. We will do that. So to the OIG, the DOJ, who's hosting us, the FBI, DEA, and other agencies that were engaged. And let me ask Kim stand in the back. Kim Grant runs, Chief Operating Officer and Deputy Administrator at CMS. She runs the fraud unit, and I'll speak about some of the work she and her team have been doing in my comments today. It is, and you'll hear this said by all of us, and we should, the largest Department of Justice healthcare fraud takedown in history. The fact that it's even possible that you could have $15 billion to play in this endeavor is shameful. But that's how we're being attacked now, and it's not done by small-time operators. As you're hearing about and you will read about, these are organized syndicates who are designing to hurt America. And why do they hurt our healthcare system? Well, CMS is probably the largest target of all, responsible for about $1.7 trillion of disbursements. So it's a big target on our side. And they can pierce the veil of protection by just getting identifier numbers from our seniors or Medicaid recipients or others, and thus use those tools, use you, the American people, to hurt us. What we're doing today is changing the paradigm. Not just going after bad guys and putting them behind bars, but actually getting ahead of these schemes so the money never leaves our bank account. Because by the time we find out that these criminals have stolen and the money has left the building, it's already offshore somewhere in some foreign country's vaults where foreign leaders are rejoicing in the fact they took advantage of the American people. That's why we use the word crushing fraud, waste, and abuse. Because this is not just a nice thing to do in an accounting pickup that we can, claw back money. It doesn't happen that easily. And this is a modern era. There are modern tools being used to attack us, and we need even more modern ways, including AI, which I'll speak about in a second, to take them down. The oversight has to be unrelenting. We can never let our guard down. While we're sitting in here right now, there's hundreds of thousands, probably millions of efforts being made to hack into CMS and our system, and we have systems designed to prevent that, to make sure the people who need us the most will find that we're there to protect them. The CMS Fraud War Room that I want to announce that Kim is going to lead is an effort as an example of this. It's prevented most of the fraudulent efforts to take money out of our agency. So most of the money never left the door. So most of the money was never stolen, even though we know you were trying to do it. And when I speak to you, when the president signed that executive order, he put a bunch of sheriffs, new sheriffs in town. And that's what you're looking at on stage today and many others like us who are not going to tolerate this anymore. We're stopping stolen taxpayer money from leaving the door, stopping it in its tracks. Just when I was leaving the room today, the offices today, I was hearing about over $100 million that we've stopped from leaving the agency just in the past few weeks. There are 27 providers that are under active prepayment review, which means we're not going to pay their money until we verify that they're actually doing their jobs correctly. There's examples from telemed schemes in Florida with clinics billing for activities that they're not really, we don't believe, providing. There's a cardiology provider, and please help me understand this, who's providing cardiology services in person in Georgia and Nevada at the same time on the same day. Unless teleporting is being made feasible, not possible, but it happens. The audacity to think you could get away with this highlights the fact that folks believe they could have taken advantage of the agency in the past. We're going to make sure it doesn't happen again. There are mental health clinics, listen carefully, mental health clinics providing skin substitute placement on their patients. Again, you're dealing with ulcers in a mental health clinic. These services are provided by an anesthesiologist. Improbable. Money's not leaving the building. You're going to have to prove to me that there's a clinical benefit of a psychiatrist telling an anesthesiologist to put a surgical graft on a patient. It's not going to happen. We need your help. That's my big plea. We need your help, the American people. Why? Over half of the whistleblower tips that we get are for healthcare fraud, and over half of the fraud against our government is in healthcare. So we need your help, both to protect your own important information. Don't give it away because con artists come to your door and try to get it, but give us tips. You're going to hear all of us share opportunities that we have, but it only happens in healthcare because we know we have allies, the American people. We provide care to 68 million Medicare beneficiaries. 80 million Americans are on Medicaid or CHIP. There's another 20 million on the exchanges. There are a lot of people that will come to help us. So write this down, 1-800-HHS-TIPS. 1-800-HHS-TIPS. We have a URL, obviously, if you go to our website as well. And I'll leave you with one last thought. In addition to the massive fraud, especially from foreign entities trying to invade America using their financial tools and criminal mindsets, we also have 25% of all of our money being spent, probably subject to abuse. And that's not fraud. This is abuse and waste. Money not being used wisely. We just launched a new model called WISER with the Centers for Medicare and Medicaid Innovation under Abe Sutton that is looking at ways for us to identify inappropriate use of services that are wasteful and should not be offered to the American people because they could hurt them, and they're certainly not providing value for these wonderful Americans whose health is being taken advantage of to generate higher savings, higher revenue, rather, for providers. We're not going to tolerate it anymore. We're going to use data analytics, real-time monitoring, and unhesitating and unwavering pursuit of the law to make sure this happens. I want to thank my colleagues on the stage and their agencies for all the wonderful work you have done. God bless you.